How are you? How is the going? How are you coping in today's circumstances? It's a good day. Happy to be alive and to share with you a few tips on our general health, especially in regards to women health. My name, James Amenge. I'm a practicing gynecologist and obstetrician. And I love making a difference, creating smiles, giving hope to families and couples, following up on pregnancies, addressing various health challenges that affect women, offering various surgical interventions where needed. And we're here to basically support you in that journey. We'll talk about one of the very common symptoms that exists amongst our women. And this is gonna be something on abnormal uterine bleeding. So we understand that once a woman achieves puberty, they experience what we call menstruation, which is loosely referred to as monthly period. Of course, it's a blood flow that is experienced in a cyclic manner between 21 days to 35 days. And everybody has their pattern. One may bleed for 2 days, and one may bleed for 5 days. And oftentimes it's minimal blood loss, changing 1 or 2 pads in a day without clots, or if any, very minimal or small clots. When you talk about abnormal uterine bleeding, we're referring to bleeding that is either in excess of what you consider as your normal menstrual flow, or it has prolonged longer than what is your normal, or it's a bleeding that is happening away from your usual cyclic menstruation. And it could be spotting, it could be continuous flow that could be minimal, or could be excessive flow that even comes in form of clots, filling pads within a very short time, and one is able to change several pads. They may be painful or associated with pain, pelvic pain, but not necessarily. Sometimes just painless bleeding. So any bleeding other than your normal menstrual flow would be considered abnormal bleeding. Any bleeding following menopause is considered abnormal vaginal bleeding or uterine bleeding. And menopause is basically that period of a woman's life when she goes through 12 months, consecutive months of no monthly period, especially when you are beyond 40, 45 years of age, and associated with significant reduction in the ovarian function in terms of its ability to produce hormones, as happens in a younger age group. So there are various things that may cause abnormal uterine bleeding. And some of these, just to mention before we probably pay attention to one, includes 1, uterine fibroids, 2, adenomyosis. We'll explain what that is. 3, abnormal bleeding disorders. 4, growths within the reproductive tract of a woman. Can start from the vulva, which is the outermost part of the reproductive organ, to the vaginal canal, the vaginal walls, to the cervix, or even a growth within the inner lining of the uterus or the whole uterus as a whole. There are other causes of abnormal uterine bleeding that could exist, like having some what we'd call polyps, which are basically small outgrowths that happens within the inner lining, okay, the inner cavity of the uterus, which would equally cause excessive bleeding. Of course, management depends on what is suspected, depends on what the diagnosis is, and they may range from either is being reassured and being observed without any active intervention, to use of medication, oftentimes using hormone-based medicine or using medication that are just helpful to stop the ongoing bleeding. And it can also range to process which we call ablation, where we are either blocking blood vessels that are supposed to go to, that is going to the deceased process or deceased area, or killing the blood vessels within particular deceased area, like for example in a fibroid. And this management can go up to and including removal of either the growth, if it is a fibroid, or removing the whole uterus. And that may extend beyond simple uterus removal, depending on what the diagnosis is. Beautifully, it's important to note that each of the mentioned conditions and many more that would cause abnormal uterine bleeding are important that we know they exist. We know how do we make their diagnosis or know that they confirm their existence, but also have the right treatment on time. So those are the things that really make the big difference. I'll pay a bit attention to what I call adenomyosis. So be with me. Every part of the body has a special function, and the special function comes from what is making that part of the body. I'll give you as an example. The heart has a special function of pumping blood to the rest of the body, receiving blood from the rest of the body. And it never stops to take sleep or break, because what makes it is so special in a way that once it is jump-started, when the life begins, it continues until death happens. That's very unique characteristic to it. The inner lining of the uterus equally has some special cells, okay, that allows it to respond to the changes in the hormonal levels in the woman's body over the cycle that we're calling menstrual cycle. And those cells are able to grow, or rather recover from a previous loss, regrow, mature up, build up food potential pregnancy that is yet to come. And in the event there is no pregnancy, they're able to have a signal from the brain and the body that there's no pregnancy that is forthcoming, and therefore they are allowed to be washed out in form of blood, which we call the monthly period of the menstruation. It's a very unique characteristic to that lining, that inner lining of the uterus. And what is beautiful about these cells are they behave in the same manner, irrespective of wherever they find themselves. And so when this special tissue or cells that are lining the inner wall of the uterus find themselves deep into the muscle wall of the uterus, we call it adenomyosis. The presence of the special cells that originates from the inner lining of the uterus into the muscle wall of the uterus, we call it adenomyosis. And why are we interested in adenomyosis? One, that this invasion into the muscle wall can be in one localized place. So you have one area that has this beautiful cells that are supposed to be on the inner side, but now is abnormally present within the wall. Or it can be widespread within the muscle wall. So it can either be what we call focal, meaning it is just one area that is affected, can be the front wall or the back wall or the left or the right wall, whichever. Or it can be what we call diffuse. Basically, it's affecting a wide area of the uterine wall. This condition oftentimes may not present with any problem. It's silently present. However, in some patients or in some people, it may be the cause of excessive bleeding in terms of during menstruation. So that while previously one would have just 1 or 2 pads, now you are changing 5 pads and more, and they're getting soaked very quickly. Probably they are even clots. And so that is excessive bleeding because of the adenomyosis. Number 2, it can actually cause pain during menstruation or during monthly bleeding. And it would be important that we pick this condition on time and figure out how do we then treat it. Oftentimes underdiagnosed adenomyosis because either we don't think about it or because it requires some form of imaging, okay, to be able to identify or confirm or suspect these lesions. And sometimes that requires a skill to be able to pick the abnormal appearance within the muscle wall of the uterus. And so it would be important for us to appreciate that you could have excessive bleeding, you could have prolonged bleeding during menses, you could have painful menses because of adenomyosis. It actually makes the uterus look bulky or bigger than expected. However, rarely does it affect fertility, so one should be able to conceive without any much struggle, even in the background of adenomyosis. How do we know that it is present? So when you present to your doctor, one of the things that the doctor will do would be to ask you a bit more information in terms of how your menses are presenting. So they could be heavy, they could be prolonged, they could be painful, and there's a characteristic nature of the pain that we're talking about. And so based on how you describe the symptoms that you've come with, then the doctor is able to consider adenomyosis as one of the potential differentials or potential causes of your problem. Of course, in addition to other issues. And of course, this will include also examination. So the doctor will examine you, would want to confirm that the vaginal canal is not the cause of excessive bleeding, there's no growth. Look at the cervix, there's nothing there that would be explaining the bleeding. Then probably would want to do a basic ultrasound. And an ultrasound basically helps us to visualize the uterus using a high-speed sound wave, which then transmits that wave into an image that we can see. And so from there, we are able to see the walls of the uterus and how uniform or otherwise they are. And we're able to tell this lack of uniformity, this small cyst-like or small fluid-filled areas within the wall could suggest adenomyosis. And then treatment then happens. Of course, there are other images that can be done, including what we call an MRI, that would be more useful. And they give us suspicion or a differential. The true certainty is or comes when we've had the tissue, for example, remove the whole uterus and take it to the lab. And then we're able to look at the cell level and see that indeed what was present there was adenomyosis or not. However, we can have a high index of suspicion based on the history, based on the examination, and based on the imaging that has been done. So then how do we treat adenomyosis? So there are a few things that we want to consider. One, what is the age of the patient? Two, what are the symptoms that are of concern? Is it the bleeding? Is it the pain? Okay. Is there desire for fertility preservation? Like this patient, she desires to get more babies or get a baby in the near future. And that becomes a big determinant in terms of what can we be able to consider in terms of treatment. Younger people, of course, vis-a-vis an elderly person who is probably postmenopausal or close to getting menopause. So the age becomes a factor. And the treatment options, based on the factors I've mentioned and more, then are either, if the symptoms are not severe, then basically it's a follow-up. So we follow it up based on monitoring how the flow is. Is it worsening? Is it remaining the same? How the pain is? We probably do subsequent scan, maybe at 6 months interval or even more, and we're able to see how is the disease progressing? What's the progression? Okay. And number two, we could just do some medication that are able to help us reduce the ongoing bleeding so that the patient is able to use this medicine when necessary. So when they start bleeding, they use this medicine to help minimize or reduce the amount of blood loss. Or pain medication, if the pain is the concern. So it can be what we'd call conservative, just using medication to reduce the bleeding, using medication to reduce the pain, and that becomes one option that exists. The second option would be use of hormonal methods, where we want to use medication that are hormone containing, either progesterone or a combination of progesterone and estrogen, to help us not only reduce the amount of bleeding, but also to regulate. Okay, and these treatments can be used for 6 months, 3 to 6 months, or even more than 6 months, 1 year, 2 years, depending on the patient's ever-changing needs. Of course, if the medicine doesn't work, or the patient is not able to tolerate the medicine, then we have surgical options. And one of the things that could be done, of course, is we can let's try and see which ones do not involve the actual cutting. And the method that exists would be what we call ablation. If you remember one of the statements I mentioned about that. So basically what we can use, for example, in our center is called HIFU. And HIFU is basically high intensity focused ultrasound treatment. So we are using ultrasound waves at extremely high speed, and that these waves are manipulated to converge to a focal point. Of course, there are conditions that would allow us not to give a patient hormone replacement therapy. And so it requires a very intricate conversation with your doctor and looking at the risks versus benefits of each treatment option before you exit. And these options exist even for women who are living with HIV. Okay? So that as much as, yes, they could be on medication for the HIV virus and probably other diseases, they are equally going through what every other woman is going through, sometimes even to a greater extent or degree. So hormone replacement therapy exists even for them, for the women who are living with HIV. And so talk to your doctor, talk to your gynecologist, look at the good and the bad and of each of the treatment options and see what solution can exist for you. Is it sleep? Is it the libido? Is it the vaginal dryness? Is it the mood swings? Is it the hot flashes? Is it the muscle and bone pains? Is it the urinary concerns of involuntary leakage of urine? What is it that is really bothering you as you get into the journey of menopause? Because unless you talk about it, our society seems not to be very comfortable to discuss menopause. And you, the one who is going through this journey, is the only one who can actually bring that discussion to your doctor and have a solution provided. If your practitioner is not able to provide that care, then they are able to link you up rightfully to someone who is able to really give you a solution for this. So yes, menopause is here with us for the women who are in that age group. It can happen early, and people go into menopause even as early as the age of 35. It's abnormal, but they still get into that journey. Some have the menopause coming in much later, even to the age of 50, the age of 55. Whatever journey it is that you're walking, there is a solution. And menopause can be discussed, can be talked about. Indeed, solutions exist even for the menopause symptoms. So take a minute, discuss with your gynecologist, and have a better experience. It doesn't have to be all pain, gloom, and isolation, and stigma, and and all the bad things that comes with the experience. Thank you.